My name is Julie Valentine, and I am an assistant professor at Brigham Young University College of Nursing. I also am a SANE nurse, a sexual assault nurse examiner or forensic nurse. I have worked as a SANE nurse for over 10 years, both pediatric cases and adult cases. I've cared for patients across the life continuum. I'm frequently asked, so what does that mean? What's forensic nursing, or what is a SANE nurse? And what that means is that I have special education and training to care for victims of violence. A SANE nurse is specifically victims of sexual violence. Unfortunately, there are a large amount of patients that have been impacted by sexual violence. In a study by Utah Commission on Criminal and Juvenile Justice in 2008, they found that 1 out of 3 Utah women will be sexually assaulted in their lifetime. 1 out of 6 will be raped, and 75% of those, their first assault occurred before the age of 18 years. I view my role in this as addressing this problem to find solutions through research. I have a number of studies that I've worked on in relation to trying to make improvements. The first one of these studies was done in 2013, and it looked at criminal case outcomes in adult sexual assault cases, specifically in Salt Lake County. I looked at 9 years worth of data, 2,241 cases, developed a random sample, and found that out of those, 6% of rape cases were prosecuted, meaning 94% of rape cases were not prosecuted. Another study that I'm doing is a collaborative study with our state crime lab, Utah Bureau of Forensic Services, where we are following sexual assault cases from 14 years and up, from the time of evidence collection through being turned into the crime lab and then the DNA analysis findings. I've done this so far for 1,874 cases from multiple sites in Utah, and out of those 1,874 cases, I found that 38% of the cases or the sexual assault kits had been submitted by law enforcement to the crime lab for analysis, meaning that 62% of the sexual assault cases have not been submitted. I've found that those decision-making policies are largely dependent upon the individual law enforcement agency. In one site, law enforcement agencies turned in only 4% of their sexual assault kits within a year of the assault. All of these kits, these sexual assault or rape kits that we collect, how many do we collect and then give to law enforcement actually ever go back to crime lab? I started asking those questions and everybody said, oh, we have no idea. It's too hard to track. There's too many law enforcement agencies. There's just no way to figure that out. And I thought, I bet I could figure out a way to track this information. I really had a turning point about 5 or 6 years ago. I'd been called to see a young woman who had been raped at a party, and she was devastated. She never thought anything like this would happen to her. And I got home and it was probably about 3 in the morning. And I just thought, her world, her life will always be affected by this. And what will happen to her? I will probably never hear anything about her case. I don't think anything will happen with her case. When the law enforcement officer picked up the sexual assault kit from me, he said, well, was she really raped? And I was really frustrated. I was frustrated by the system. I was frustrated thinking that nothing will happen for this victim as many other victims, and thought I need to do research in this area. And that was that night. That was my turning point. And I luckily have an incredibly supportive husband. And I talked with him that next morning and said, I need to go back and get my PhD. I need to develop the skills. I need to get the resources, the experience, the education so that I can research what is happening with sexual assault in our community and try to make a difference. So these large databases that I'm developing in collaboration with other agencies will be leading to many other studies. The hope is that as we understand sexual assault better in Utah, understand our victims, we will then be able to develop prevention programs and also be able to increase the investigation and prosecution of sexual assault cases in Utah. Throughout all of these, I have the blessing of working with wonderful students. Students that really get to see how they can be change agents in their community, how research and evidence and data can drive improvements, and their perspective and their energy has benefited all of these studies.